Hi, my name is Savannah Willmore, and I am in 400J with PERCOM, and today I'm going to be doing an assessment on a patient with severe anaphylaxis. So this is going to be severe anaphylaxis at a private residence. So to start, we're going to get the call from dispatch giving us pertinent information related to this patient. And I am going to make sure that while we are en route, I am preparing my chart and I'm going to approach with any appropriate PPE, including gloves, mask, face shield, gown, ballistics vest, whatever is appropriate for the situation. And right when we pull up to the residence, I'm going to conduct my initial scene size up. This is going to be a clear, non-hazardous private residence. There's not going to be any electrical, chemical, thermal, weather-related hazards that we're going to run into. There was no reports of weapons from dispatch, and I'm going to see my patient sitting here outside. It doesn't appear the patient has any weapons that I'm aware of, and it doesn't appear like the patient is going to have any aggressive behavior. So the environment's not hostile, doesn't appear to be any bystanders. The hazard, which was the patient was stung by a bee per dispatch. The hazard of the bee is now gone, and so I don't have any concern for myself or for my partner. I've also considered my need for additional resources en route. I don't feel like I need to use PD, fire department, or anything else at this time, and I just have one patient. My nature of illness is relayed by dispatch as a bee sting to the face. I would take a spine board if precautions were indicated. However, this doesn't seem to be a trauma-related patient, and I can see my patient sitting here at their residence when we pull up, so I will not take a spine board with me. So when I first approach my patient, I'm going to introduce myself, grab my monitor from the truck and my red bag as we need it for this patient. I'm going to introduce myself. Hi Pedro, my name is Savannah. I'm the medic on duty today, and either I will introduce my ALS partner as well, or they introduce themselves. It's kind of just the dynamic that we have per whatever team. So I see my patient sitting here. He seems alert. He is still awake, and I'm going to give him a GCS of 15 based on the fact that he is able to respond to questions from us and is eyes open and all of that good stuff. And my patient, we're going to start with our primary assessment, which is ABCDE. So airway, since my patient is replying to me, we're going to assume he's able to maintain a patent airway. However, it was discussed that the bee sting is on his face, so we're going to do just a quick little extra assessment of the mouth, tongue, and back of the throat to make sure there's not going to be any obstructions that may need us to take action to secure his airway in the next couple of minutes during our assessment. So next we're going to assess his breathing, and since this is relayed as a severe anaphylactic reaction, I'm going to assume that it's probably going to be 2 or more body systems involved. So if I take a look at my patient, I might notice that he has shallow and rapid respirations, which we have a respiratory rate of 28 here. I'm also going to take the opportunity to tell my partner, can you please take a set of vital signs? This will include taking a blood pressure by placing the cuff on his arm. We're also going to put a pulse ox on the opposite finger to make sure that it is accurate in real time. And I'm also going to have the 3-lead hooked up to the patient just real quick to make sure there's no immediate life threats. And a temperature if possible. However, it may be construed if the patient's been sitting out in the sun or something like that. So we may just take that back to the truck when it's a more controlled environment. I'm also going to take this time to take a manual pulse on my patient. And I'm going to note that the pulse is rapid and thready at the radial, which our rate is 120 based on our monitor. We also have a blood pressure of 85/50. So I would agree that this patient is having a severe anaphylactic reaction, and we do need to take action quickly. So right before we move the patient, I am going to listen to his lung sounds as well, because I do hear some expiratory wheezing. So I'm going to start by listening to all 4 sectors here. Take a deep breath. Take a deep breath. Take a deep breath. Take a deep breath. And I'm also going to listen to the back. Because sometimes, depending on the size and shape of your patient, it may be easier to hear adventitious sounds in the back. I'm going to note that he has inspiratory and expiratory wheezing in all 4 lobes of the lungs when I listen on my assessment. So we need to take action pretty quickly and load up this patient into the truck and start providing treatment before I can continue with my assessment. Now, since it's very clear that he's having a severe anaphylactic reaction, we are going to immediately administer 1 to 1,000 epinephrine IM. I'm going to take my injector, insert the medication tube in my injector, and I'm going to plunge it into the outer portion of his thigh to get some relief going, since we don't want the reaction to continue. We want to try to counteract it because he is starting to have a decompensation based on his vital signs. I am also looking at his oxygen saturation here, which came up as 85% on room air. So we immediately want to put the patient on either a simple mask or an oxy mask. I am going to put it up to 10 liters per minute while we're kind of waiting for that epinephrine to kick in and see if it helps him a little bit. And we're also going to start an IV on him very quickly because he has hypotension. We want to do a 1 liter bolus of normal saline. We're going to run it wide open to try and get that pressure up. And he probably is still going to remain quite tachycardic, especially getting epinephrine. So getting fluids will kind of also help him a little bit. Once I have my IV established, I'd like to do 50 milligrams of IV Benadryl to help counteract any allergic reaction he has. If he still has inspiratory and expiratory wheezing after our initial treatments, I'd also like to do an albuterol treatment via nebulizer for him. After we have him in the truck and we kind of have done our initial interventions, I'm going to do another quick assessment just to see if our interventions are working. Hopefully his blood pressure has come back up. Like I said, he probably will still remain tachycardic, and we're getting the oxygen saturation up. And I'm going to start my secondary assessment. So I like to get a sample history on him. You know, we already know that he was stung by a bee in the face, and that his face started swelling and he had expiratory wheezing. So those are kind of the signs and symptoms of anaphylaxis. We want to ask him what his allergies are, what medications he's on, and what kind of pertinent medical history he has, like COPD, any cardiac issues, things like that, that might help us in treating him on the way to the hospital. We'd also like to know his last known well time and or last meal eaten, last drink taken, and any events leading up to this situation. And then we are going to ask him if he's having any pain. And if he is having pain, we'd like to know onset, provocation, radiation, severity, time that it started, things like that. Then I'm going to do just a quick one-over of him. In my area, we have a pretty short transportation time in town. It's usually like 5-10 minutes, if that. So I'd like to look over head, neck, arms, chest, abdomen, back, legs, and feet. He may or may not develop a rash. He may or may not get hives. And we just want to do a one-over just to make sure that the bee sting and anaphylactic reaction is the only thing going on with him. We also need to continually assess his mental status and if there's any neurological defects, and make sure that he is still maintaining his airway. We'll continue to reassess the patient during transport, and I will provide a radio report, or so we use Pulsera around here too, which is an electronic reporting system to provide the hospital with vital signs, intervention, and any other pertinent information for my patient. And that is how I would treat an anaphylactic reaction.